Welcome back. COVID numbers are no longer going down. The CDC wants states to reopen more slowly, and that is the key. Dr. Ebony Jade joins us now. And Dr. Jade, thanks so much for getting up early and starting your day with us. Let's start with Johnson & Johnson. They rolled out that new vaccine yesterday. Will this one shot, will that drive the numbers down, or still not enough? Things have to move slower.
Yeah, I mean, it's one of these things until we reach this critical mass of people that are vaccinated, we just can't rush the process. And at this point, nationally, we only have 7.5% of the US population that's been vaccinated, right? And we need to get that upwards of 70, 80%. And so adding on another vaccine for sure is critical, but it's also very important of who are we actually vaccinating? Because at this point, largely we're vaccinating primarily white people. And we really need to get our racial minority groups involved in that vaccination process because we are the essential workers. And that's how this virus allows itself to spread.
Well, I have to ask you, what can we do to get those numbers up? Is there anything we can call a congressman? How do we get those numbers up in our black communities?
Right. And you hit it on the head. Calling our elected professionals. I mean, it is one of these things when we're looking at the way the vaccines have been allocated. Black people are largely left out of that qualification. For instance, phase 1A, 60% of healthcare workers are white. When we're looking at even nursing home residents, 78% of all people who are in a nursing home are white. It costs money to put your family there. If you look at phase 1B, we even dropped that down to the age level of, 75 originally, although black people, our life expectancy is only 75. They then dropped it down to 65. But if you look at the US population over the age of 65, 77% are white. And then even when you go to looking at employment, if we say essential workers, what we know is that black people, unfortunately, were the first persons that are fired, the last ones hired. And by April, less than 50% of all black adults actually had a job. So the way that we are tying these vaccines, this life-saving intervention to age and to employment is racist.
I like the way you talk, just plain like, and just put it all on the table because that's what's going on. I love it. So hopefully you'll join us often. President Trump, unfortunately, we got to go backwards on this one. We learned recently that he did indeed get the vaccine, a COVID vaccine. He got it in January. And remember, there was a lot of talk, questions. The White House press corps wouldn't answer it. Well, now we know. What difference would it have made had he done that? Then the president of the United States, in the middle of this deadly pandemic, had he done it publicly?
Right. Well, we have always known President Trump to be a selfish person, and that was politically motivated. He couldn't tell the very followers that he said that this pandemic is a hoax, that now he's taking this life-saving intervention, although he took millions of dollars worth of medical, treatment for his own COVID-19. So I wonder, at this point, for his followers, for those 74 million people that voted for him, I'm not even sure really if it would have done anything to sway them at this point. We know they have cemented themselves to this idea of everything anti-science, everything anti-public health measures. We still can't get them to wear a mask, even at their conference this weekend. So I'm not sure on their front. But what I do know is that he did nothing to support the nation in this pandemic. And it's cost us not only our lives, but I call it the casualties or the collateral damage of this pandemic. We'll see increase in our orphanages. We'll see increase in disability because 30% of those who've recovered actually have long hauler symptoms, and that's heart failure. That's symptoms of neurologic damage. These are people that no longer have functioning kidneys. There's a lot of things that we're going to have to unpack within these next 5 to 10 years as to exactly what does COVID do and how do we, repair the consequences of that infection.
Yeah, if you look at the numbers, on polling numbers, you see a lot of his supporters even refuse to go and get the vaccine. They still think it's a hoax for some reason. Real quickly, we got about 30 seconds. The CDC director has come out and warned against taking it too lightly, reopening too soon. But with everything that's going on right now with the numbers, are we headed in the right direction going into the summer?
Right. What we're seeing is a downtrailing from the holiday effect, right? We had a huge surge in our cases related to Thanksgiving, Christmas to New Year's Eve, and that's tapered down, but we're still burying. We're still having 2,000 people die a day. This is not over. We have got to be vigilant. We have got to wear our masks. We have got to social distance, wash our hands. And Black people, get the vaccine. You see clearly the people in power that have money, that have influence, they were the first persons in line jumping over your 80-year-old grandmother in order to get this vaccine for themselves. This is really a matter of life and death.
Great information. Dr. Ebony Jade Hilton hanging out with us here today on BNC. Thank you so much for joining us today on BNC and Start Your Day.